Hello, my name is Divya Karki. Here's my small presentation about chronic illness among the older adult caused by social environment. Outline includes Introduction to Social Determinants of Health, Social Determinants of Health Continued, Case Study, Chronic Disease among the older population. How does the social environment contribute to developing chronic disease? Lifestyle risk factors, role of primary healthcare nurse. Social determinants of health. According to WHO, social determinants of health are the non-medical factors that determine health. They are the conditions in which people are born, grow, work, live, and age, and the wider the set of forces and systems shaping the conditions of daily life. Social determinants of health continued. The factors of social determinants of health are education, income and social protection, unemployment and job security, working life conditions, food security, social environment, housing, basic amenities and the environment, early childhood development, social inclusion and non-discrimination, cultural conflict, access to affordable health services of decent quality. Case study. The social determinants of health have a disproportionate impact on mortality in men. This presentation discusses the influence of social environment, which is one of the factors of social determinant of health causing chronic illness among the older adult aged 65 years and over. Chronic disease among older population. According to Australian Institute of Health and Welfare 2020, at 30th June 2018, 3.9 million Australians or 16% of total population were aged 65 or over, and of those people, 47% were male. The social determinants of health have a disproportionate impact on health among the older population. Chronic disease are one of the many public health concerns, being the cause for the decline of well-being in older people. In contrast, AIHW 2021 illustrates that the leading cause of death for older Australian men was coronary heart disease, followed by dementia, Alzheimer's disease, and cerebrovascular disease. The report of AIHW 2021 also shows that the life expectancy of older men is less than that of older women in Australia. The vulnerability of the older adult is related to chronic disease, conditions invited by the unhealthy living status, negative community attitudes, and that results in unhealthy aging. How does the social environment contribute to develop chronic disease? The World Health Organization in 2008 defines social health as the political, economic, and social forces under which people live. Good health will be the result of social equality, social stability, higher income, social class, and national security. Being higher on the socio-economic scale is correlated with being in good health. Allen 2016 states that chronic stress caused by a negative social environment causes inflammation and high cortisol levels, which causes disability, disease, and mortality. Exposure to negative stereotypes on ageism adversely affects the behavior, cognition, and attitudes of an older person. Social behaviors are associated with health outcomes in later life. Cherry, Brown, Kim, and Jazwinski 2016. Recurring negative experiences can be traumatic. Hence, older men living in chronic stress and depression increase the risk of chronic disease, social isolation, and other adverse health outcomes. According to the research of Silverman, Nutini, Musa, Schonberg, and Albert 2009, negative response like loss of identity, and physical limitations were received reflecting upon existing chronic disease. In this study, the older men were likely to have less income, disease severity, and disability. Therefore, support from family, caregivers, or relatives and a healthy social environment are crucial for healthy aging. Other social factors include income, race, and education. Lifestyle risk factors. Chronic conditions and lifestyle behavior have a direct influence on the quality of life among older adults. An unhealthy lifestyle invites early functional decline and boosts illness. Chronic disease often emerges after prolonged exposure to tobacco use, excessive alcohol consumption, physical inactivity, and consumption of unhealthy diets. Jamieson, Fitcham, and Makgova et al. 2006 demonstrates that unhealthy lifestyles are associated with chronic disease like diabetes, obesity, hypertension, COPD, chronic obstructive pulmonary disease, arthritis, and hyperlipidemia in later life. Chronic disease like diabetes can be prevented by active lifestyle and consuming healthy diet in an early stage. According to Jentsch, Allen, Fuchs, and Lippe, 2017, modifiable health risks are responsible for one-third of the global chronic disease burden and rank among the most common risk factor leading to death in developed countries. Hence, it is very important to modify unhealthy behavior into a healthy lifestyle. Secondly, substance abuse has been identified as a risk of unhealthy lifestyle among older people. Cognitive decline or addiction may be the main cause of substance abuse. The patient with comorbidity, chronic disease, or chronic pain has a high potential for substance abuse. Opioid painkillers for chronic pain are the most abused medication among older people and develop an addiction at some point. The research of Wilsnack, Christensen, Vogelzans-Holm, and Gmail 2009 states that men exceed women in drinking and high-volume alcohol and experience more behavioral problems related to their drinking. Therefore, adopting the healthy lifestyle at an early age prevents comorbidity, the burden of disease, malnutrition, obesity, physical inactiveness, substance abuse, or health deterioration in later life. Role of primary healthcare nurse. Low individual health literacy is associated with higher use of health services and low level of knowledge among consumers and poorer health outcomes. Berkman et al. 2011. Health literacy as a social determinant of health is important among the elderly and promotes healthy aging planning by enabling them to make their independent choices and decisions. For chronic disease management, nurses must facilitate a person's access to an understanding, evaluation, and use of health information, providing health literacy using effective communication skills on topics such as medication management, healthy living style, and choosing a positive social environment can improve control over their health. Patient education about medication administration is important for those with comorbidities with an increased risk of polypharmacy. Hence, nurses should communicate effectively and provide a person-centered care approach to minimize polypharmacy and substance abuse. Nurses promote public health by directing elderly people about health and wellness information such as smoking cessation, addiction counseling, nutrition and hydration information, avoiding chronic stress, getting enough sleep, and eating a healthy diet. Nurses also make care plans for functional, cognitive well-being, wound and pain management, and direct interdisciplinary teams according to the condition or chronic illness. Nurses play a vital role in the management of chronic disease clinical settings by delivering service by person-centered approach and preventing comorbid conditions. Primary healthcare nurses make it possible to manage complex chronic illness intensively with appropriate training and effective teamwork. These are the evidences. Thank you. I hope you found my presentation useful. You have a good day.